Good afternoon, everyone. This is Linda Smith. For those of you who know me, I am the director of the Early Childhood Initiative at the Bipartisan Policy Center here in Washington, D.C. BPC is a Washington, D.C. based think tank that tries to take the best ideas from both sides of the aisle to create good policies for the issues confronting our nation. And actually, I don't think there's any more pressing of an issue than the one that we're going to talk about today, and that is the issue surrounding our families and childcare and getting our nation back to work. So I want to thank you for attending this, and as we go along, you will see that there are opportunities to pose questions about what you're going to hear today and comments, and we would certainly encourage you to do so. Before we get started, I want to thank the Overdeck Foundation for our work, supporting our work on parents, and for the Klingenstein Family Foundation for the work on this survey, supporting our survey work. So between those two, we sincerely appreciate their support and think that we are learning through this work a lot more about parents than we knew prior to this last year. So before we get started, please remember that you can submit your questions in the chat function on YouTube and Facebook or through Twitter at BPC Action or BPC Live. So again, encouraging you to please submit questions or comments on this work. So I'm going to move on now to talk a little bit about the background and why we are doing this work. This is the third in a series of surveys that we've conducted with parents. And the work started originally through the work that we were doing to try and understand the gaps in the potential need for childcare in our country versus the supply and what we actually had. And as we started digging into the data, we understood that, in fact, we didn't understand what parents were wanting and that their decision-making process is driving a lot of what's going on in our country. But with very little understanding, it was hard to predict what we actually needed to do about the supply. So we started looking back at parent issues in October of last year. And our first survey really focused on parent decision-making. What were they doing? Why were they choosing what they were? Then we were about ready to go out with another survey in March when, guess what, COVID-19 appeared, and we had to pivot to take a look at what was going on with childcare during COVID-19. So in April, we went out with another study, and we started to look at what were parents with children under 5 doing for childcare during this time. So now we went out in the third of these, what parents are doing again with childcare. But one of the things that we learned during the last experience was that we did not understand the difference between the paid and the unpaid category of childcare. If you look at the census data right now, census estimates that 61% of children are in some regular childcare arrangement. However, only 32% of parents actually pay for care. So we were trying to understand, and we've been trying through this particular survey, to get a better understanding of what parents are doing if they're not paying for care. Where are these children and what is going on there? So you will see that throughout this, but that was in the first bullet on the slide. What we were trying to do was understand a parent's use of childcare prior to COVID-19 with a specific and new interest on paid versus unpaid care. Then the next thing was to look at what's going on with working parents now with the COVID experience as opposed to what we learned in April, what their needs are and what their decisions are about returning their children into care. Then, because of the situation with the public school system and the somewhat challenging schedules that schools are going to be on this fall, we wanted to understand what parents were going to do with their children who would normally be in school and therefore not need care, but now do. So finally, we want to have a conversation with you all about the future implications for the childcare industry across the board. So moving on, this survey was conducted between August 3rd and 10th with 1,000 parents who had at least one child under the age of 5 at home and had someone in the household employed in January of 2020. So you see the margin of error there, it's plus or minus 3. So moving on, this time in this survey, we tried to dig into some things that we had not looked at in prior surveys, specifically wanting to understand what was going on with income levels of families, race and ethnicity, the community setting, by that I mean urban, suburban, and rural, and then the number of children in the household. And so one of the more interesting things that we have this time, and for those of you who are really like to dig into data, I would encourage you to take a look at what we now have in the survey, because we actually ask parents by age of child, birth to 6 months, 6 months to a year, 1, 2, 3, 4, 5, etc. So we have the breakdown by age of child, and we haven't done as much analysis of that as we would like to do. We hope to do more in the future, but there is data now on some of their decisions as they exist in terms of the age of their children. So these were some of the things that we looked at. We also looked obviously at current work status, and another thing that we tried to look at this time after examining the results of previous surveys was trying to understand multi-generational households. So, and that for the purposes of this survey was defined as a household with 2 generations over the age of 25 in living in the household, to understand what's going on. Is there grandparent care? What's going on with that? And then finally, separating out and looking at the essential workers. And obviously 63%, as the slide shows, say they are considered an essential worker in their state, and that either they are, and that 63% say their spouse or partner is also. So important information that we can dig into more as we look at the results of this survey down the road, but definitely things that we want to be aware of and understanding as we move forward with trying to understand and fix the supply of care in this country. So here are the key findings, and we're going to go into these as we go through the results. The most used child care arrangements for parents in January of 2020, they were essentially were looking at family, but we're going to talk more about that, but that they differ by those paying for or not paying for care, and especially by income level and ethnicity. And so those are things that we need to dig into again and understand. That COVID-19 is impacting child care providers' operating status and in turn impacting parents' ability to work. No surprise to the people, I think, watching this. But needing to understand exactly what that means in terms of the numbers of families, and you'll see that later on. That a third of the parents have sought childcare during COVID. However, it has been difficult for them to find it. Again, not a surprise, but especially to find quality childcare within their budget. And we'll look at this data by income levels in just a few minutes. When asked about the top of mind considerations for sending their children back to childcare programs, they talked a lot about health and safety precautions, the need for a vaccine, and concerns about getting others in their household sick. And then finally, 2 in 5 parents with school-aged children, 38%, will look for a childcare provider for their school-aged child if their school does not open in the fall. And there's some interesting things that we found out about this particular population, which we think you'll find interesting as well. So moving right along here to the pre-COVID arrangements. This is a chart that looks at those who paid and who didn't pay. 45% of parents were paying for childcare in January 2020, and 61% of those were paying full time. This is a little bit different than the census data, and this is something that we'll have to try to understand. The census data, I should also note, should be updated here soon, and we may have seen changes since the last census, but compared to the census data, which showed that Essentially 32% were paying for this. The results that we found was much higher than that. So somewhat interesting, and we'll have to look into that more. Those who paid and those who didn't pay for childcare, 45%, I'm sorry, I'm on the wrong slide here. So parents in multi-generational households, those with an annual income over $75,000, and parents in urban areas were more likely to pay for childcare. And this is a very interesting thing, because if you look at the income data, and this is where I think we're going to have to get a better understanding what is going on, and it's probably not a surprise again to people on this call, but to see the numbers of parents with incomes less than $50,000 who are paying for childcare, that is really significant. And that does speak to the cost of quality care in this country, and how we are going to begin to figure out how we can make this care affordable to more of our families. So once you get over $75,000, obviously those numbers start to reverse. We did not look at incomes higher than that, but suffice it to say that the trend is going in the direction of the more money you make, the more you can afford childcare. Also, a look at the rural versus the urban issues, that childcare in rural communities, that parents are less likely to be paying for childcare if they are living in a rural area. So again, interesting things about who's paying and who's not. Turning to the next slide, we wanted to look at the primary arrangements for parents both paying and not paying, and where they were. And this was in the 2020 what they were using, and then we asked this question again for those now. Family members or relatives is 21%. And I think this is again a place where we need to actually begin to think about how we support our families and this issue of relative care. I think the other thing that stands out on this slide for me, and I'd be interested in people who are watching this to hear your comments about this, is a look at what we would consider the unregulated or the friend and neighbor care. And I think there's been a perception in our country that a lot of children are in this kind of care, but consistently in this and the next question, you'll see that friend and neighbor care is not a big factor, that it's mostly family members or relatives that people are using, or alternating work schedules if it's within the family. And then the rest is, where are they if they're not there in a child care center, privately owned, or a family child care home, and then it falls down below that. So you can see what that looks like. So now we want to talk a little bit about the impact of the virus on child care programs. And I think this is one that was of concern. And I think if there's a headline out of the survey, I think you're going to see it. And here it is, that over 70% of parents report that their child care provider is either closed or operating on limited hours or space, or limited to only essential workers. Now, this is a serious issue, because the supply or parents' access to childcare has been severely restricted. So no surprise when they say they have a difficult time finding childcare. In the next slide, this back up. I hit it too hard. This varies, whether childcare was closed or open varies by setting. And so more center-based programs are closed, and closed permanently. 14% of parents said their center was closed permanently. On the other hand, 8% of parents using family childcare said that their program was closed permanently. And this is pretty consistent. The 29% of parents said their programs made no changes to their operating status throughout this. That was pretty consistent with what we found in In our April survey, which was 28%, said their family child care providers were still operating and were still available to them. So I think that there's something to be said, and we've known from other work and from our work with state administrators that there is a lot of interest in family child care. This just goes to demonstrate that this form of care is going to be an important part of the child care landscape going forward. So now 44% of parents are unable to work in some form without child care. 22% can't work remotely or in person, and another 22% can't work remotely or return to work without child care. If you do the math, this really is millions of people. And so we really have got to pay attention to the childcare issue as we start to reopen our businesses and our economy, that parents simply aren't going to have choices of going back to work without childcare. And I think we here in Washington keep making that point to our friends on Capitol Hill, but I think it's even more important now as we get some real solid numbers behind this. The sidebar, these are things that we pulled out of some of the demographic information, that 27% of parents with incomes less than $35,000 say they cannot return to work in person or remotely. 35% of Hispanic parents can work remotely, but not without childcare. And finally, 38% of Black parents say they can work because they have childcare in their household. So these are some of the nuggets that we're pulling out of the information. There's a lot more to be thought through here, but just some things that you might be interested in. So childcare arrangements now during COVID, if you look at this number of those using a family member, remember when I said that back in the previous slide where they were 21% were using family members. Now that's up to 32%, with significant increases all down the line in terms of continuing to alternating work schedules is up from 8% to 13%. And then some of the other things about working fewer hours, taking leave, and so forth. So continuing to use their previous childcare arrangement, that makes sense at 17%, since so many of our childcare centers were closed or have been closed during a part of this. So this just says a few nuggets that we took out of the childcare arrangements. Again, 37% of parents who were not paying for childcare but in a formal childcare program before the pandemic are now using family care at this point. Also, again, parents with incomes below $50,000 who were using a formal program say they are more likely to rely on a family member now. And then 24% of Black parents who were using a formal program, they're continuing to use their previous arrangement. So what did we find out about childcare needs during COVID here? And I think what we have found out that despite parents looking for childcare, it is 54% say it was difficult to find quality within their budget. And that included, and I think here is another showstopper, that 72%, almost 3/4 of parents with incomes under $50,000 are having a hard time finding childcare. And if you think about the implications of that, the fact that these parents are, many of them are essential workers, and many of them are in the service industry, and they are having a hard time finding childcare. So I think these are, again, important things that we need to pay attention to. Okay, of the 72% of parents with an income below $50,000, interestingly, the group that says it's the most difficult, and I know these are hard to read, but if you look at the income under 50,000, 72%, income 50 to 75,000, 60%, but also rural families are having a hard time finding childcare, and that was at 61%. So some of these things we need to start thinking more along the lines of location and some of these other issues around the income that are so prevalent in some of what we found here. So now, returning to childcare during COVID-19, and I want to stop here and remind everyone that to please submit questions or comments in the chat function, if you will. We're really interested in terms of your reaction to some of this and your experiences in the areas and communities that you live and work in. So again, the chat function is up. So now, what about returning to care? Parents are split on when they plan to send their children back to care, and this has implications we're going to talk about at the end. But many parents are waiting, in the little box, for public schools to open, a vaccine to be available, or for their previous child care program to open up. One of the things that we learned, if you look at the numbers of parents who said they do not plan to send their child back to a child care program, and then the other ones waiting. We did learn something from our survey work this time, is that we're going to do a better job of figuring out a time period for under the 59% who said they don't plan to send their children back. For how long, we didn't ask that question, and we will need to do that in the next go around. But we assume that many of those parents are holding off in those other categories. So what were basically the factors that they considered? I think it was interesting that parents really are struggling with balancing the needs of their children for learning opportunities and just general development, for social emotional socialization activities, with their concern about the virus and to a lesser degree their issues around returning to work. I think this is a really positive slide in so many ways about not a surprise, but positive, that parents are very concerned about their children's learning and socialization activities. And I would say that just a reminder in terms of what parents were saying, that 32% of these programs are still closed, and that is a factor in their waiting. So returning to work, let's look at this. I think what will their plans be when they do decide to go back to work? Where do you plan to send your child? Again, a lot of parents still looking at their spouse, their partner, to provide care, alternating work, etc. So again, these numbers are pretty consistent, and we're going to have to think through how we support these families in the interim. The essential work category, an interesting point there, where 59% of them are counting on family members to provide that care for their children. So high numbers there. So we asked what their preferences were for returning, and if cost were not a factor, what would they prefer in terms of sending their children back to childcare? And I think, again, here's some interesting information. When the 43% rank family-owned or individual family childcare centers in their top three, 53 rank a family member or relative, and then 31 a home-based program. In looking at childcare, this is not a surprise. If you go, the survey is going to be posted online at the end of this, and you can see the questions that we asked. But we did ask the difference between a small neighborhood facility and a bigger childcare program. And we all know that about 2/3 of childcare programs serve fewer than 75 children in this country. That's according to the last National Survey of Early Care and Education. So many of our programs are small, and I think that's what parents are looking for, in particular when it comes to their comfort with putting their children back in care. So the next slide, this changed dramatically from the last our survey in April, when we asked them how comfortable they were with putting their children back in care. I think this one was a standout. So they're most comfortable with putting their children with families. and they're not comfortable with sending them back to a child care center. And I think we're going to have to pay attention to this, because it's in our survey in April, 75% of parents were not, were not comfortable. I mean, back up and say that again. 75% were not comfortable in sending their children back to a center. So we've got some changes there, but we need to take these numbers seriously. What are parents concerned about? In the box, you can see that 77% of parents are concerned that their child or their family member will be exposed to the virus if they return to childcare. And that's a very serious thing for families to think about. I was asked earlier today by someone if parents were, or if parents were concerned about grandparents and relatives. And we did ask an open-ended question on this one, and yes, they are. If they're grandparents or elderly relatives, the parents did express a concern that if their children were in childcare, that they would come home and be a risk to some of the elderly parents and relatives. So that's something to be paying attention to. So if we look at health and safety measures in childcare programs that are important to parents, you see those on the side. 91%, of course, are interested or concerned about the hand washing. The frequent communication was right up there at 89%. Reduced group sizes, 86%. So in effect, I think parents like what's going on with the group size restrictions that are in many places around the country. Required use of face masks for staffs, and then more stringent sick policies for both children and staff. But if you look at these, all of these were ranked pretty high, and everything got up there at least above 70%. So parents are paying attention to health and safety measures. And I think one of the things I've said repeatedly to people who've asked me about this, if childcare doesn't know one thing, we know health and safety. And so what we really need to do is be sharing with parents basically, what we're doing already and what we have been doing, as well as what we're doing additionally, because it's for a long time, we've known these things about hand washing, etc. So again, what are most important to parents? Sanitizing, temperature checks, required testing of the staff, and the use of face masks among staff. So take a look at those things. And I've been watching what some people are posting. I think people are pretty aware of that around the country. So here were some of the parents. We asked some open-ended questions, and we have some interesting, and these are representative comments that we for parents when we asked them what their considerations were for sending their children back to childcare. Health and safety, you can see that. Ensure my children are at a safe facility where other children and my children are routinely checked. There should be safety measures such as required masks and sanitation. Regarding the vaccine, I'm really waiting for a vaccine. I know that children aren't going to keep their masks on. I think that's something that we all struggle with, but there's this grandparent issue. Therefore, the virus could be spread to household members, causing but not limited to grandparents and older people, etc. Concerns about sickness. Children are more likely to not follow guidelines and keep their masks on. That's a fact. I think chasing a toddler around to keep a mask on would be a full-time job. So kids are, as according to this parent, kids will get one another sick, kids will get their caregivers sick, and caregivers will get kids sick. So I think we really have to do some thinking about that one. Because as this parent says, it's absolutely impossible not to be close to little children in a child care center. So that's something to be thinking about. And then finally, this one on not returning, this parent said, I live in an area that doesn't believe the pandemic is real, even though it's getting worse. I will not send my child to a daycare where they could be exposed. It's just not good at being a good parent. So I think there's some real concerns out there. Now moving on, we wanted to take a look at the school age issue. And our thinking about this one is how it's going to impact the childcare industry. So what we looked at, and we asked parents what was going on with their schools. And so you can see up there that a hybrid online and in person is the most common that parents are reporting. Entirely online learning, entirely in person is very low, and that some with a decision that is yet to be made. The point I think we all need to think about here is in the case of children either in a hybrid model or in an online learning setting, those children are going to need childcare. And that's where this next so this is this is a little bit a further explanation of some of the schools and what they're doing, what the hybrid model means to them. Students will alternate days in school, which poses issues for childcare because children in care in school 2 days a week will need care, not for full time, etc. Phasing in care in the earlier grades, that has implications for childcare as well, because the children in K through basically K through grade 4 are going to really be present challenges here. Students alternating between attending schools 1 week off. So interesting things going on with the schools, and we're going to talk about this in just a second, what that means. So of the parents who have school-age children, 38% of those parents say they will look for a childcare provider if their school doesn't open in the fall. And of those parents would prefer a formal childcare program or a provider for those school-age kids. But on the other hand, how many of these parents have it in their budgets to actually pay for care? And 75% of the parents surveyed said that they would not be either able or willing to pay for childcare. And this is one of the other things that we're in our next survey we're going to have to clarify, because that was kind of a question that was worded for both, and it would be interesting, but we think that most of that is because of the cost of care and the fact that parents have not been budgeting for this, did not see this one coming, and really don't have it in their budgets to pay for it. Of the 25% who said they could pay for care, we asked them to enter an amount that they would be willing to pay, and this was the average, $212 a week. So I want to really spend some time now talking about the implications of this. So here is our take on the implications of this, and not a surprise that 70% of the childcare programs either closed or operating at reduced capacity presents real challenges for our childcare community. Without support, these programs have two choices. Somebody might argue and say there's another choice, and I'd be happy to hear that. But mostly they're either going to close or they're going to raise parent fees, because they simply can't operate without the revenue, that they need to pay their staff. And so the implications of these reduced operating hours and capacities have serious implications. They have long-term implications for our families, businesses, and our nation as a whole. There's no question that families and businesses are not going to be completely back to normal without childcare in some fashion. So we, again, need to give some serious thought to this. And I know many of us here in Washington are working on this in the supplemental with Congress, but this is a real concern to our families out there. The next implication is that parents are reluctant to send their children back to care, and that was demonstrated throughout the survey. So the implication of this is that if we want to prevent a catastrophic loss of childcare infrastructure in this country, the financial support needs to be predictable and sustainable. And I think we are in this for a little bit longer than a lot of people are right now thinking. But if parents are really seriously not going to put their children back in care until there's a vaccine or some of those things, child care programs cannot hang on for months and months and months. They simply can't do it without some kind of predictable financial support. The school schedules. These are going to place, and the school schedules are putting parents in a really difficult position. As we said just now, that 75% of parents are unable to pay for care. That is a serious issue. This could result in more young children being left at home alone earlier. And that is something that I think our country has been trying very seriously to deal with and to move beyond parents leaving their children, in after-school care by themselves. It's a danger for so many reasons I don't have to tell this audience. So we really do need to be paying attention to this home alone issue. The other thing that has possible implications for this is on destabilizing the current amount of care available for infants and toddlers. Because as we know, child care is more lucrative, if you will, for school-aged children. It's easier to make the bottom line if you can have more school-aged children than 1-to-4 ratios of infants and toddlers. So we have a certain risk here of losing capacity in terms of our infant toddler programs. And this will be a difficult decision for child care providers to make, because if it's between survival and making decisions over school-aged children versus infants and toddlers, I think survival could win out. So we need to be, again, thinking about that and how do we work on this to make sure that we don't lose infant toddler capacity. And as I said, we did look at the data by age of child, and we haven't dug into it yet, but we're really interested in looking at some of the implications of this study on the families with children under 3, which we will be able to do. And then the final one is that these decisions that parents are making around childcare and going to work are serious. One of the things that I've been saying as I've talked to different groups around the country is that policymakers need to be sure to work in close collaboration between school leadership, businesses, and childcare leaders in their communities. In many cases that I've been involved in, childcare is an afterthought. And so after schools have made a decision to close or go remote or do virtual, then somebody figures out that childcare is going to be a problem. So we need to be thinking these things through and putting these groups into a room at the same time and getting people to think about if we could just figure out how to get people in the same room making a decision at one time in the best interest of people in their community. So with that, I'm going to invite my colleague, Sarah Tracy, who worked with us on this survey, to join me in this. And we're going to start to take a look at some of the questions that have come in and see what you all have to say about this. And the one thing I like to say at the end of anything that we do is we're sitting here in Washington, D.C., and we are trying to communicate with Congress what's going on with childcare. So if you have specific things that you think people in Washington need to know, please share them in the chat right now, because we need to be carrying the message from people around this country about what's going on and the serious need for action here in Washington. So Sarah, what do we have? Sarah's going to put up some of the questions that have come in.
Yeah, so we have a few questions. I'm going to start by answering actually Christina's question about when the data was collected. The data was collected August 3rd through August 10th. So that was the first one. And I will ask a question from Juliana, who is saying, I'm hoping you will address the concept of community learning centers. It seems like these will be important in many communities, and especially for families where parents must return to work.
Could we ask her to define what she means by that? Because I think this is one of those things where I have been asked this question, and I think it means different things to different people. And I'd really like to hear what exactly her definition of that is.
Okay.
So I'll put that back to her.
The next question is from Jolene McNeil. Can we conclude anything about a parent's trust in their childcare provider?
Not a direct issue about the trust in the provider, we can't, but trust in the whole circumstances around putting their children in childcare. And I think if you go back to the quotes that were up there, and I would encourage people to go to our website and look at some of this, because the comments are interesting. I don't think it's a lack of trust of their provider. It's just the circumstances under which these providers find themselves. So when the parent said, you can't trust a toddler to wear a mask, that's real. And so parents, that's no reflection on the childcare program or the childcare provider. It's just simply reality, and parents know it. And so I think that, one of the things that we have got to, think through is, where we can, how can we help alleviate parents, help them with some of what they're concerned about? But I don't think it's an issue of not trusting their providers. Right. And of course, you don't get that kind of an answer from a survey like this, but you can take nuggets from the comments that we get. And I think I would have to go back, and Sarah, I'm sorry, I didn't mean to cut you off there, but I would have to go back and say that I think parents are pretty astute on some of these issues based on what we saw come in and the comments that we saw.
Great, thank you. A question from Nina Perez. Have you looked at how many parents have had to leave their jobs or been fired because of childcare breakdowns?
We have not in this survey looked at anyone firing. We just know that we just did ask questions about who was currently working, and there is data in there about who's working, whether they're working remotely, part-time. We did ask some questions which we didn't show about the amount of care they need, how many need full-time versus part-time childcare. And there's some interesting things in there that most parents are looking for full-time being 4 or 5 days a week care. That's what they're needing out there right now. And we asked some questions about hours and days of week to make sure we understood that. So there's some data in the survey on that, and yes. So.
Barbara asks, can we get consistent rules about what it takes for schools and childcare to open? They're operated by different bureaucracies, and it's very confusing for parents.
Barbara, I would second you on that. I do think we've heard this repeatedly as we've done a series of listening sessions with family childcare providers, with people from the faith community, for all over the place over the last several months. And I think there is a genuine lack of consistent information out there, and parents and childcare operators are confused. So I think that there has been some information on the Centers for Disease Control website that you can go to look at, but consistently, I think we do need to take this on, and I think that there's a real need for that, for exactly what you're asking. I wish I had a wand and I could do that.
Building on that, I wanted to ask also, what can childcare programs be doing to mitigate the risk of transmission, and how can they assure parents that they're taking the right precautions?
Mm-hmm. Yeah, we've been looking at that, a fair amount, and I do think that there are some things that we need to do, both that can be done that are easier to do for example, hand washing, sanitation, some of those things, which I said I do think childcare does a really good job of. But then there are other things, and Sarah in particular has been working on some of the infrastructure pieces, because we have a lot of childcare programs that are old in this country and don't have, for example, sinks in the classroom. And I was describing this to somebody who didn't quite get this the other day in terms of can't they just take the kids down the hall? Well, in my history, I have run a childcare program where that exactly was the situation. So every time a teacher wants to take a group of children to the bathroom or to wash their hands, they have to take the whole group. So you can see that's, things like sinks in classrooms is really important for young children. So we've been looking at this and are working on what we think are model standards to put out on this. We've written something on it. Sarah's got a blog that she's done on it. So there are things that can be done that could help this. Some of them are easier and are pretty much, as I said, hand washing, sanitizing, that kind of thing, versus structural things like sinks and partitions and some of those things.
Great. Juliana got back to us. She said, thank you. I'm referring to a place where children can go. This is about the community learning centers. I'm referring to a place where children can go during the day to be supervised during their remote learning time. I've heard that some YMCAs are offering this service and other cities are.
Okay, Juliana, yes. This is actually a great question, and I'm actually glad you clarified that, because we have been working jointly with the After School Alliance on this issue, and one of the proposals we have put forward to Congress is to put some funding into a supplemental bill that would fund 21st century learning centers. And that would be through the education department. A lot of the YMCAs and the Boys and Girls Clubs, yes, that is going on, and we've heard about it in many places around the country. When that is an option, it's a good option. We think that we need to provide support to that, and that support should come through the 21st Century program. So if you want to go to our website, we have a proposal that we would be happy to share with you and talk to people about this, because not all things have to fall necessarily to the childcare, the early childhood programs. There are options in communities, and again, getting back to this issue of in advance getting schools and businesses and childcare programs all together in the same room, that's when these things start to happen. The YMCA, I heard of one place where 13 Ys were actually working in a community to provide this care. So it can be done, and it's a good option.
Great. This question is from A. Hardy. Did you discover any implications for women, both single and married, who are having to decide between working and providing childcare, particularly when compared to men?
We haven't looked at that data yet, again, but we do have the marital status in our data. So you can go online and look at that, or we'd be happy to take a look at it ourselves and talk with you further about that. We just, in the first cut of the survey results, we did not look at that. But it is a big issue, and single parents for sure. But in terms of the whole working mother situation.
Great. And then Kathy Tama is asking, what are some of the potential policy solutions to meet the parents' needs?
Well, I think the policy solutions really do have to do with funding and getting some stability in the childcare supply right now. And those of you who know me, I'm famous for my little description of why we need to put money into the supply side of the equation in childcare in this country. Right now, these programs rely primarily on either subsidy payments from the public sector or parent fees. And there's not enough money in either one of those to keep these programs whole during the next, several months. So in terms of what we can do is to meet parent needs, we really do need to shore up this supply side of the equation and get enough money into the system so that parents can afford it. And that is only going to come, in my view, from some kind of a shared responsibility between the public and the private sector. I think the country as a whole, this is Linda Smith personally thinking this, is beginning to understand the seriously fragile nature of childcare and the cost implications of that. So we simply cannot pass these costs on to parents. And I think when you look at solutions to meeting parents' needs, it's going to be to somehow invest in the supply so that we can bring down the cost to parents and more parents have access. Because if you go back and look at those numbers of children, of what parents are choosing for children who are in families under $50,000 or under $35,000, their choices are limited, very limited in terms of where they can put their children. So again, back to, and not to belabor this point, but back to some of the earlier points is we really do need to understand this parent choice when it comes to the income. And are they, in fact, really, blocked out of the childcare market for the most part?
Here is a comment that maybe you can respond to. Given likely higher use of family, friend, and neighbor care, it will be essential for schools to reach out to these caregivers to support remote learning. Already we're providing a lot of care before.
Well, I want to go back and separate out the family, friend, and neighbor issue, because I think that's one of the things that we saw and what I tried to point out in the earlier slides is that not as much of this care is in the friend and neighbor category. In some cases, it was in 3%. So I think we do need to do something to support families during this time. But we do, I think, and we have actually had proposals that we have put forward on supporting family childcare and home-based providers through networks. We need to get our family childcare community organized and supported. And it's hard to support when there's one here and one there and one across town. We really need to figure out how to create systems of support for family childcare so that we can get them the information and the support they need to do this well. And I think a lot of people are coming to understand this issue of this need for family childcare. And especially back to the point on the slides earlier, since 29% of those family childcare providers stayed open throughout this. They were one of the most reliable sources of care in the country. And we need to do a better job of acknowledging that and supporting it.
Great. I just want to encourage anyone else to submit their questions. We have a few minutes left. I am looking right now for Katie Beckman's question. Can $212 a week actually support full-time school-age care? Not where I live, she says.
Not in most places in this country. That's also a limitation, that parents are faced with. Even the 25% who said they could pay for childcare, that's a problem. Does that support an actual quality program? Probably not.
Maybe one more question.
Okay.
Christy Balka. It's a comment. Public policies have a role ensuring individual providers aren't forced to make the decision to drop infant toddler care in favor of school-age children solely for money or financial reasons.
Well, yes, there is a public policy aspect of this, and the public policy aspect is to get the rates up. That especially when it comes to subsidized children, that the rates are reflective of the cost of doing childcare, not just the market. And I think we've written a paper on this and want to have further conversations with people about getting us away from a market market rate system, which tends to undermine everything that we talk about in terms of quality in this country. So that's a really good point. And it's really true that public policies do dictate a lot of this. And it's especially a problem in family child care, where in most states in this country, family child care rates are less than center rates. And so we have basically family child care providers who are working longer days, irregular hours, overnight, you name it. They're working more hours at less pay when it comes to the market rates that are dictated by state subsidies. And so again, I think we need to think about this. Our policies need to move more towards a cost of care model, and how the public reimburses these programs then sets the tone for what happens with the rest of what goes on in childcare. But this market rate, I cannot tell you how much I think we need to rethink that.
Great. Thank you. That is about all the questions that we have.
Okay, there were a couple I'm showing on here that are in the chat that I'm seeing. Do we need to go back to the PPT for closing? I think, oh, I'm sorry, that's a different, sorry on that one. Do we, something read, was there enough data to disaggregate by state? That's it, I'm sorry. Only in a few cases, we oversampled some states for reasons of our funders' interest in those states. But no, this is a national survey, and we cannot disaggregate by state level. Sorry about that. We wish we had that kind of money to do that, but we don't. Okay, is that it?
I think you have some links on the last few slides, Linda.
Okay, so moving right along, what we have done, we've created a page on our website that where this data will be shown, but also has the data or the information on the two previous surveys. If you want to go back and compare the October, then the April 2020, and the new data, the crosstabs, everything will be up there for those who really like to dig into some of this data. You can have a great time, I think, with all of it. So we learned a lot. We're still learning in terms of asking the right questions and getting the answers that we need. But we think we're getting a lot closer to understanding what parents are thinking, their choices, and how they're making decisions. Because I think until we understand where parents are, we really cannot have a conversation about how to balance our supply issues and how to fill in the gaps for parents where there isn't any childcare. So I want to thank everyone for joining the webinar and for the great questions. Keep them coming. If you have more questions, feel free to contact us. We are very much interested in learning from these things as we go along and doing a better job of asking the questions that will get us the answers that we all need to know. So thank you, and I hope everyone has a happy end of summer and a great Labor Day, and we will hopefully get something done here in Congress that can provide some of the funding that we need for these programs to keep operating over the next several months. So thank you, everyone, for participating.